The athlete was a 23-year-old male basketball player who plays guard at the collegiate level and experiences some exercise-induced asthma from time to time. Some previous history that the athlete had stated was that he had a mild ankle sprain around 2 years ago. Athlete was at an off-season practice working on some one-on-one drills with a teammate, made a cut to the right, rolled his ankle. He stated that he heard a pop in the ankle and was not able to put weight on the left side. Athlete's range of motion was limited when measuring active range of motion along with passive range of motion. Range of motion was limited when testing plantar and dorsiflexion, but the athlete had no range of motion whatsoever when testing inversion and eversion. When palpating the ankle, athlete had some tenderness along the distal tip of the lateral malleolus along with the posterior edge of the lateral malleolus. Visually looking at the ankle, athlete had some moderate signs of edema and effusion, but no signs of ecchymosis. When testing muscular strength bilaterally using the manual muscle testing, dorsiflexion and plantar flexion were much lower scoring, a 2 out of 5 and a 3 out of 5, compared to the right ankle scoring a 5 out of 5 with both plantar flexion and dorsiflexion. Athlete tested positive for the anterior drawer test, the inversion Taylor tilt test, and the tib-fib squeeze test. So the athlete has a noticeable limp on the left side with minimal weight bearing. Obviously, this affects the athlete's future performance in athletics, whether that be at practice or competitions. This also could affect the daily life of the athlete, whether that be walking upstairs or standing for long periods of time. This also could affect the academic performance because of the possible missed classes. Also could affect the social engagement, reduced participation in social activities with teammates or friends. So my preliminary diagnosis for the athlete is a grade 3 lateral ankle sprain.